It is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM, and this is Indiana in the Morning, presented by First Commonwealth Bank. Our interview segments are presented, as always, by Marcus & Mack, a law firm representing injured people. Well, Pennsylvania now has a new way for people to get much-needed health insurance. It is called Pennie. And here to explain the in and outs of Pennie is actually the new executive director of the newly established Pennsylvania Insurance Exchange. He is Zachary W. Sherman. Zachary, it is good to have you on our show today here on Indiana in the Morning. Welcome.
Hey, thanks, Todd. Thanks for the opportunity to be on today.
This is actually Josh here. So Todd's.
Sorry, Josh.
And no worries. The people get us mixed up all the time. Don't worry about it. Let's go ahead though and talk about what Pennie is all about. Now, as I said, you're the executive director of the Pennsylvania Insurance Exchange and of Pennie. So, talk about how Pennie came to be.
Certainly. So Pennie is the Commonwealth's new health insurance marketplace. We have replaced healthcare.gov. We are in the midst of our first open enrollment period. We are the only source for financial assistance to help pay for coverage. Nearly 9 out of 10 of our customers receive some form of financial assistance to reduce the cost of their monthly insurance premium, or in some cases to reduce their deductible or their copay. Pennie is the result of bipartisan, unanimous work in the General Assembly and with Governor Wolf to create a state program to give more to Pennsylvanians. We were paying, in 2018, we were paying something like $98 million to the federal government for use of healthcare.gov, and leaders across the state really realized that we could do more with that dollar. We could get more for Pennsylvanians. So they created a program, state-based marketplace, Pennie, to replace healthcare.gov. And they also created a program to reduce the cost of health insurance in the individual market from what it would have been without these programs, and got 2 programs for the price of 1, didn't spend any additional money, and resulted in better access to quality care and more affordable health insurance through the marketplace.
So you've overseen Pennie in its initial phases, and I know that this is the first open enrollment period for the Pennie website and the marketplace. How are things going?
Things are going well. Things are going really well. We've seen a lot of great activity so far in open enrollment. We're almost at the end of our second month of open enrollment. So far, through renewals and new customers, new enrollments, we have about 325,000 Pennsylvanians who have enrolled in coverage. We started with the process of giving people currently enrolled through healthcare.gov the ability to automatically renew, automatically transition over to this new program, new website, new platform. About 265,000 renewals, whether they're automatic or active, have come through, and then almost 60,000 new customers have come in and enrolled in coverage. So we've been really excited about the interest we've seen thus far, and there's still a couple weeks to go. The last day to sign up for coverage during open enrollment is January 15th. Pennsylvanians, because of this program, have more time this year to get covered. And again, January 15th is the last day to sign up for 2021 coverage.
So that extended deadline, is that because of this being the first year for the Pennsylvania marketplace?
It's that's part of it. It's because as a state-based marketplace, because we have control of our operations and our policies, we have the ability to have a longer enrollment period.
Okay.
And we decided that having a longer time period is beneficial, and it's something that we will do in future years as well.
You mentioned a lot of the benefits that have come about because of the fact that the state is taking over this healthcare concept, this health coverage marketplace concept. So talk about some of the other benefits that the state is going to reap.
Yeah, that's exactly right. By taking control of our own operations, we have the ability to serve Pennsylvanians where they live, have more direct, put more resources into outreach and education and marketing, and to really have a tailored approach to awareness that is specific to the diverse and different nature of the Commonwealth. So previously, the the healthcare.gov approach to marketplace was 35 states, one size fits all. We now have put more money and more resources into in-person assistance across the Commonwealth. We have partnerships with health centers, nonprofits who provide tailored one-on-one application assistance. You can go to our website or give us a call and get an appointment with them, whether it's in person or virtual. We've partnered with thousands of licensed insurance professionals across the Commonwealth, brokers. We've trained them, certified them. They have their own accounts within our platform. You can get connected with them wherever you are, and again, you can do that through our website or calling us. We've created. We have a number of tools online available for people to navigate the process if you want to go in and filter plan options based on what's most important to you, whether it's your premium or your total out-of-pocket cost, or whether or not your prescription drug or your doctor are covered by the plans in your area. Those are tools that we've provided, and you know, we've done all this. We've been able to do all this at a lot less money than we are paying for use of the federal marketplace. And this is at no cost to consumers. And I guess the last thing I would say is we have a dedicated call center where people can call in if they don't want to navigate the process themselves. We have a call center. The number is 1-844-844-8040. This is a call center dedicated to Pennie, to its customers, at no cost to our customers. If you need application assistance, if you have questions, they're there to help, and they can walk you through the process.
That's amazing. We're talking with Executive Director Zachary Sherman of Pennie, Pennsylvania's health insurance marketplace, which is going through its 2021 open enrollment period right now, and that open enrollment will expire on January 15th, so people who need to pick up insurance can do so through the Pennie website. And the website is, I believe it's pennie.com, right?
It's pennie.com. It's PENNIE.com.
Yeah, we should make that very clear distinction, because people might type in thinking penny as in like the coin penny, but it is PENNIE.com. And you've been with this program, it sounds like, from the very beginning of this, from the very start. And the idea of it, again, is trying to help Pennsylvanians get the health insurance coverage that they need in a more affordable way than what was started with healthcare.gov, which was a very good start in and of itself.
Yeah. I've been fortunate enough to be part of this program and organization since the beginning, since the fall of 2019. The idea, the concept of making health insurance more accessible, more affordable, is something that I was very excited about being a part of. And our broad overarching goal is to reduce the uninsured, to make accessible to all Pennsylvanians affordable, high quality insurance. And over the last several years, the Commonwealth has made great strides. I think something like 5.5%, or nearly 95% of the Commonwealth has insurance, but there's still, some several 100,000 Pennsylvanians without access to coverage. And having access to coverage means having access to healthcare services when you need them, as well as preventative services and all the things you need to enable you to live a healthy and productive life, and to protect against unforeseen catastrophic events and financial ruin. So having health insurance is very important for all of those things. And I'm very excited by this, by how many Pennsylvanians have already come in and gotten covered, and am hopeful that trend will continue over the next couple of weeks as we lead up to the January 15th deadline.
One of the things that I was looking at as part of the research into this interview was a no wrong door policy that Pennie operates under. Maybe you can explain that a little bit more for our listeners? Yeah,
absolutely. So oftentimes when you come in, if you're uninsured and if you are looking to access health insurance, you may not know what program you're eligible for. So if you come to Pennie and apply for coverage, and based on your income, you're eligible for medical assistance or CHIP through the Department of Human Services, we won't be able. We don't necessarily enroll you directly into those programs, but because we're a state program, we have a partnership with the Department of Human Services, and we can get your application over to them, and we can facilitate the process of getting you to the right place so you can complete your application and get enrolled in medical assistance or CHIP. So that's a great benefit of this program. If you apply at DHS and you're deemed likely eligible for coverage through Pennie, it's the same process. So we have a partnership with them to ensure, even if you're not eligible for our programs, there's a pathway, an easy pathway to the right place so you ultimately get insured.
It sounds like the biggest thing about the Pennie website is to make things easier, to make things very easy for people who need to get the health insurance to be able to get it, because things can be complicated whenever it comes to health insurance, and people can get intimidated by it. And you said that you have that call center ready to help people out in case they do need the assistance, but you also, it sounds like the website is very easy to navigate around as well to find the health insurance that people would need.
That's right. We know this process can be overwhelming. We know it can be complicated, and it's also very personal. Having the protection against the unforeseen that you need to have peace of mind is very important. And so we aim and strive and work very hard to give people tools and resources in an unbiased way to allow them to get that peace of mind. So whether it's online or calling us or through the in-person assisters or the insurance brokers that we partnered with, there's a number of ways in which we help. It's at no cost to you. And it's all towards the goal of giving you that peace of mind and that easy access and a good customer experience, the ultimate goal of having health insurance.
We're just about out of time, Zach, but before we go, we do want to let people know once again of how they can access Pennie and go into the marketplace. So the web address and that customer service call center phone number once again?
Certainly. So the website is pennie.com, PENNIE.com. Our call center is open Monday to Friday from 8 a.m. to 7 p.m. and Saturdays from 8 a.m. to 1 p.m. The phone number is 1-844-844-8040. And the last day to sign up is January 15th. And also our call center will be open until midnight that day.
Excellent. Zachary Sherman, the Executive Director of Pennie, thank you very much for joining us on Indiana in the Morning. All the best to you and everybody in your organization. Have a happy and safe New Year.
You as well, Josh. Thanks so much for the opportunity.
Thank you. And thanks again to Zachary Sherman for joining us here on Indiana in the Morning, presented by First Commonwealth Bank. Our interviews are presented by Marcus & Mack, a law firm representing injured people.